What we are trying to do is to take a number of countries and let us, over a period of years, get the entire system of use of research evidence revolutionized. Behind it lies an entire movement, what we are really calling an entire movement, a movement to get research used. What we are trying to insist on is that future development of these policies, of these programs, should be based on evidence that has been gathered through research or will be gathered through research. And that unless we do that from now, we could find ourselves having spent a lot of energy, a lot of money, a lot of resources without achieving what we want to achieve. It is absolutely crucial because we are in a situation of limited resources. And the decision as to what you do with those resources should be based on evidence that what you are going to do is cost effective. It is as simple as that. But in practice, of course, it's not practiced. What is missing and what SURE is going to provide is the guidance that comes from research. The guidance that says this will work because we know it works. This will not work because we know it doesn't work. That, we hope, will be what in 3, 4, 5 years will be the overriding principle of our development in mental health. When we've gone around the country, we've found a lot of research being done, but it's not accessible or easily accessible to those who have to make decisions. Some of it is published in international journals or indeed in our own local Zambian medical journal, but most policymakers do not go for scientific journals, so there's lack of access. We are encouraging a scientific process for arriving at the priorities. And if that process is followed and we arrive at that priority, then it follows that resources should be allocated accordingly. What is, I think, a weakness is where nobody is sure how we ever arrived at 1% as being inadequate for this area. We want to show why it is inadequate, if it is inadequate. So research does not stop when the policy has been formulated. Research continues to see the factors that influence successful implementation, the factors that are deleterious or dangerous to implementation. So it is a continuing process. I think in the 21st century, we are beyond that stage where we try to guess. No matter how intelligently we do that, we don't need to guess when research has given evidence in support of certain measures, against certain measures. Why not use it?